for today, anonymous question and answer session, we're going to be taking a couple of questions and then giving the right answers to them. Why is it that each time my husband ejaculates inside of me, the sperm do come out immediately? We would advise that you opt for some certain sex style that will improve a deeper penetration. So we're looking at sex styles like doggy, which improves a deeper penetration, meaning that once the man ejaculates, that the sperm or the semen gets to the innermost part of the vagina, almost getting to the cervix, thereby reducing the likelihood that most of it will. Can I use boric acid for Candida albicans? And what type of drugs can my partner treat himself with? Boric acid is not a solution to everything. So you go around, for people that advertise it on social media or for those that advertise it in other places, they tell you what boric acid can do, how we can increase libido, how we can take away every form of infection. But that is not true. I am 26. I had my first sex at 23. And ever since then, I hate sex. But one thing I don't understand is how people talk about it being the sweetest thing. Could it be I'm suffering from something or what? Hello, you're welcome to another episode of the Intimate Matters podcast. And on this podcast, we take you on a deep dive into the world of sexual and reproductive health. We talk about the most intimate aspect of your health. And today, as you can see, I'm here all alone because this is where we get to interact with our fans. This is our anonymous session where we get our fans who had sent in questions before now, and we respond and we react to all these questions that they have sent in. It is why it's essential that you follow us on all our social media platforms. We are on Facebook, on Instagram, we're on TikTok. We are also on WhatsApp. You can join our WhatsApp channel and you'll have a chance to send in your questions. And for today, anonymous question and answer session, we're going to be taking a couple of questions and then giving the right answers to them. So we just head straight into the first one in no direct order. This question says, nurse, please, why is it that each time my husband comes inside of me, the sperm do come out immediately? Why is it that each time my husband ejaculates inside of me, the sperm do come out immediately? And this is a very, very common question among the female folk, especially those that are trying to conceive or those that are trying to, get pregnant. Because there's a conception, or should I say misconception, that it is essential that the sperm that has been ejaculated needs to stay inside the body in order for pregnancy to occur. And this is very, very true. Nonetheless, the fact that your husband or your partner, as the case may be, ejaculate into your vagina and you see sperm flowing out of the vagina doesn't mean that you do not have a chance to conceive or pregnancy cannot occur. Now, the force of ejaculation and the different mucus that we have inside the vagina, the vaginal canal and the cervix is enough to trap and hold as much sperm as it is needed in order for pregnancy to occur. So millions of sperm are ejaculated every time a man has to pour into the woman. Yes, all these millions of sperm will not end up getting the lady pregnant. It's just one or two at most that will end up getting the woman pregnant. But then all of them have a role to play. And the ones that stay inside your body as a lady, those ones are enough to cause pregnancy or to cause you to conceive. So it's not something that you should really be worried about. It doesn't mean that as the sperm is flowing out, it means that all the sperms or all the gametes that would have caused pregnancy has flown out. So it's a misconception and it's something that ladies do not have to worry in such a case. But oftentimes, just because of the psychological aspect of it, it's essential that some people will want to see that their body retain more sperm. We know that trying to conceive comes with a whole lot of emotions, things that affects the emotions. So just to help them psychologically, we would advise that you opt for some certain sex style that will improve a deeper penetration. So we're looking at sex styles like doggy, which improves a deeper penetration, meaning that once the man ejaculates, that the sperm or the semen gets to the innermost part of the vagina, almost getting to the cervix, thereby reducing the likelihood that most of it will also drain out. And sometimes it's essential that as a lady that you need to elevate the base of your waist. So sometimes you may need to use a pillow so as to, elevate the angle and ensure that more sperm is retained. Nonetheless, even as the sperm may pour out, it doesn't mean that this will affect your fertility. The ones that have gotten into the body are enough to cause pregnancy. Then for the next question, it's also a question from a lady. It's also a question from a lady talking about, nurse, each time my husband ejaculates inside me, I usually experience a burning sensation inside my vagina. Please, what could be the cause? Thank you. Now, when you see questions like this, the very and most likely cause to this could be that this lady has a semen allergy. She's allergic to semen. Now, you could be allergic to semen in general, meaning that any semen you come in contact with, you're allergic to it, or you could be allergic to a particular semen from a particular person. So for this lady, first is for her to look at her history. As this often happens every time that she has intercourse. If this has always happened, then it could be she has a generalized allergy. But if it's just with the husband, then that means she's allergic specifically to the semen of the husband. Now, when we talk about semen allergy, just like people react. So an allergy is, the body having a very serious reaction to any substance. So we see people react to things like they may react to some substance in water, react to grasses, pollen, drugs, or some chemical constituent of particular substances. In the context of semen allergy, it means that the woman's body is reacting to a constituent in the semen, either semen in general or in the semen of this particular person that she's having this allergy to. So now this allergy may be severe, it may also be mild. If it's a semen allergy, as in this our case, it could be that this is a mild form because it will just come with itching, just like when people have mild form of normal allergies, right? If you see people that are allergic to, let's say, a particular grass or a particular weed, if it's a mild allergy, they will just have maybe rashes and a little bit of itching. But there are people that may have severe reaction to that same grass, and it becomes a very severe allergic reaction leading to anaphylaxis, meaning that the airway becomes constricted, the person is having difficulty breathing. So this also happens in semen allergy. So we may have like the minor reactions, like in the case of what we're seeing here, it could just be itching. Then we may have the severe forms. There are people that have severe semen allergy that they need to get to the hospital because they have some anaphylactic reaction. Now, when this happens, people usually wonder, how do such a woman have sex? How then does she get to conceive? Because for conception to happen, it's essential that the sperm come in contact with the vagina because that's where it's going to travel. So we'll start with the first part away from conception. When it comes to sex, what is advised to people who have issues with semen allergy is that they have sex with protection. Very, very essential. So they make sure that they're deeply protected from the process of, having the sex to the process of ejaculation to withdrawing. They ensure that there is no contact between the semen and the body of the woman. That is for people, that's for having sex. But in the context of trying to get pregnant, because we know that it's essential, they may need to cause some treatment to the lady herself. So in the context of treatment, there may be treatment options slowly to help the body manage the allergy. So when this happens, in the long run, the allergy may not be as severe and this lady can actually get pregnant. But sometimes they may need to opt for other forms of, conception, like assisted reproductive technologies like IVF, if the reaction is so severe. So there are drugs and there are treatment modalities. If you notice something like this, as in the case of this woman, it's essential that you go to the hospital and get properly diagnosed. This will help, to rule out other differential diagnoses. But this is really looking like a semen allergy. So for the next question, the person asks, can I use boric acid for Candida albicans? And what type of drugs can my partner treat himself with? So I want to talk about boric acid because, especially in the African climate, Nigeria, it's something that has been greatly used and greatly abused. Boric acid is not a solution to everything. Now, if you see the way it is marketed in the Nigerian space, it's marketed as like a one-stop shop to everything that has to do with vaginal infection. So you go around for people that advertise it on social media or for those that advertise it in other places. They tell you what boric acid can do, how we can increase libido, how we can take away every form of infection. But that is not true. Boric acid is an antifungal infection. It can only work on fungal infection. Now, we have so many different parasites that may cause infection. We have the viral infection, we have the bacterial infection, the protozoa infection, then the fungal, and so many other. So boric acid can only help. It doesn't even cure all forms of fungal infection. It can only help in some fungal infection. And it's not something that should just be used as you would love to. It's actually a drug that is supposed to be prescribed and you're supposed to use as prescribed, knowing the fact that you may get to a point where you develop resistance to it. So in the context of this, yes, boric acid can be used if you have an infection, a yeast infection, which basically the most prominent infection will be from Candida albicans. But is it something that you should use all the time like people are using? So you see people just buy boric acid and they just keep it at home and they just keep inserting it and keep using it as the case may be. No, that should not be so. So you have an infection like this, do not use it except it is under prescription. It's quite essential that this has to be said, because if you use it more than it should be used, if you abuse it, you stand a risk of getting resistant. Now, when you have antibiotics resistance, or when you have any resistance to any drugs, it could be antibiotics, it could be antifungal, it could be antiviral. What this means is that the microorganism you're trying to fight, in this context, the Candida albicans you're trying to fight, you've exposed it so much to this antifungal that it has become used to it. So like the Nigerian people will say, the microorganism, the Candida, don't they get odeshi now? So anytime, so we take these drugs, for example, boric acid, like a bullet. So normally you're supposed to shoot with a bullet and the bullet will penetrate and the Candida will die. But when you expose it so much, it develops this immunity or a resistance to it that even when you take it or you take it, it cannot do anything for it. There is no function whatsoever, right? So when this happens, the little infection you have that could have been treated will now need more heavier, more expensive drugs. So it's essential that you use it the way it is prescribed. For your partner, and I think it's essential because I think this is a lady asking this. For men, oftentimes men think they don't have fungal infection, right? Because by virtue of the anatomy of the reproductive system, it is more manifest in women than it's manifest in men. So men feel they don't have fungal infection. That's why you rarely see a man go around saying he's looking for treatment for fungal infection. But yes, a man can be infected, can have a Candida albicans infection. And yes, such a man also needs treatment. So when the appropriate tests are done, there will be appropriate drugs that are recommended and prescribed. And you and your partner are supposed to take these drugs. That's what he's supposed to treat himself. Now, why is essential that you put your partner also on this treatment therapy is the fact that if you don't, you get reinfected. That's usually what happens. A reinfection occurs if you do not. So because the men do not have manifest symptoms, except in extreme cases where the fungal growth starts to show on their penis, but sometimes they do not have it like the women. If a woman has a fungal infection, there will be discharges and the rest, and she'll know. But the man own doesn't really give a very manifest, symptom until it is like in the extreme stages. So if you do not treat him, what it means is that as a lady, in the context of this lady, the more you treat yourself, you go back to meet with your partner keeps reinfecting you. And the more your partner keeps reinfecting you, the more likely it is that you develop resistance, because it will mean that you keep taking treatment option. So it's quite essential that your partner also get treated. So please, yes, boric acid can be used for a Candida albicans infection, but it should not just be used because it can be used. You should go to the hospital, have the appropriate test done, and then drugs will be recommended. If boric acid is one of the drugs recommended, please use it. Sometimes other antifungals are recommended and you can use it and it will be okay for you. Now, another question is still on boric acid. I heard somewhere that boric acid can block the cervix. How true is that? To say it quite plainly, it is not true. Boric acid cannot block the cervix. It is not true. But then there could be a context to this that could lead to boric acid blocking the cervix. I think before now I talk about antibiotics resistance, right? So when antibiotics resistance occur in the context of maybe abusing boric acid and you have like antifungal resistance, if an antifungal resistance occur in this context, what this means is that you cannot treat this fungal infection. And then we have an upward movement of this infection. So when there is this upward movement, the candida moving from the vagina into the other organs that are in the pelvis, other sexual and reproductive organs that are in the pelvis, it now infects this organ in the pelvis, leading to pelvic inflammatory disease. Now, when this happens, pelvic inflammatory disease then manifests in so many ways. Now, in one of the ways it may manifest, it may lead to scarring of some of the tissues in the organs. If it scars the tissue in the cervix, it could narrow the cervix, leading to blockage. It can go to affect the fallopian tube and also scar the fallopian tube, stopping, the free flow of egg and also restricting ovulation and menstruation and the rest. So if boric acid is abused, it predisposes you to, developing resistance. And what this means is that infections then can go upward and affect other organs in the pelvis, leading to pelvic inflammatory disease. And this pelvic inflammatory disease may lead to blockages in various organs in the pelvis, one of them being the uterus. And we know that the cervix is at the boundary between the vagina and the uterus. So that can happen. But for boric acid to directly block the cervix, no, it cannot do that. Now, this other question says, I am 26. I had my first sex at 23. And ever since then, I hate sex. But one thing I don't understand is how people talk about it being the sweetest thing. Could it be I'm suffering from something or what? All right, so sex, like everything, is subjective. It's subject to people's perspective. Everybody, if you take a sample, if you take a poll on the street, everybody have their different perception about sex. Some people will tell you that it's the best thing after sliced bread. Some people will say that they do not see the hype about it. Some people will just tell you it's just there, it's in between. Sometimes I enjoy it, sometimes I don't enjoy it. Some people will tell you that they don't mind having it every day. They can never have enough of it. Some people tell you that once a year is okay. Some once a month. Some once every Easter market there, which is perfect for them. But then in your context, the first sex oftentimes is very painful. So that alone is enough to affect your perception about sex. Oftentimes, the first sex is always very painful. So if you want to judge sex from your first sex, you may have a wrong judgment about it. Now, it's not just about the actual act of sex. Sex is psychological and emotional as much as it is physical. So what means is that there are some contexts that need to be considered. We already know the when of the first sex. Where did you have it? Who did you have it with? What was the circumstances? So for people who may have suffered sexual trauma or a form of sexual abuse during like their first sex, they may tend to see sex may be a problem to them, right? So it's essential that that is established. So that will help you to know why you hate sex. So I feel that, yes, some people love sex, some people may like it, but I feel that people who hate sex, underline the word hate sex, something is wrong. You may not love it, but you shouldn't hate it, right? Something is wrong. And oftentimes, first you need to look at it physically. Is there something wrong with your genitals? Is there something wrong with your vagina? Do you feel any pains while during the process of having sex? It's essential to rule that out. But oftentimes in cases like this, it's often tilted to the psychological aspect. That's why I talked about the context of your first sex. You cannot expect somebody that was sexually assaulted to want to enjoy sex or to love sex. Such people oftentimes come to hate sex. right? So it's essential that you get to know. So now you're asking, what could you be suffering from? There's so many things. It could be you could be having, you could be having a post-traumatic stress disorder, right? From the fact that the context of what happened. It could be that you may have been injured during the first sex. So the pain, the body keeps memories and reacts based on the memories that it has already kept. So that could be your issue. Then for people talking about sex as if it's the best thing, please, they're not lying. Some people genuinely enjoy sex and they love it. So don't hate them. Don't think that they are exaggerating. Just know that that's their perception. And don't feel bad about yourself also. You are entitled to also have your perception about anything sex inclusive. So it's essential that I would advise that you go see a psychologist. First, you go to the hospital to ensure and rule out that there's nothing wrong with you physically as it pertains to your genital. Then you go see a psychologist. And if possible, check your history of your first sex, how it was. And if there was any trauma, you need to work with your therapist and see that you work through this. And I can tell you, yes, I won't promise you that you end up to love sex, but then you will not hate sex any longer. All right. So this question says, Nurse, I don't enjoy sex at all. I always feel pain while penetration. Please, can you help? Except this is in the context of the first few times you had sex, like the first 3 to 4 times you had sex. It could be understandable that you have pains during penetration. But if it is something that is always recurring, everything is not okay. Something is wrong somewhere. So we're going to start with you. You need to look at yourself first and ask yourself if you are appropriately lubricated, if you are appropriately aroused, if you are wet as you should be. Because if you're actually dry and there's penetration, we know what happens with friction. So if two rub together, heat is generated and sometimes pain is generated because this will stimulate the pain sensory endings in the body part, in this context, the vagina. So there will be pain. So you need to look at your sexual stimulation if it's appropriate, if you're ready for it. Now, it's not just about how you're physically stimulated, because oftentimes people worry about the physical stimulation. It's essential that you look at your psychological stimulation. Are you like in the mood for what you're about to do? Right? Because some people may be there physically, their body is there, maybe for whatever reason, maybe they're doing it as a form of duty, but their mind is actually off what they're doing. It's essential that you are in the game, if I should call it that. So you should not be feeling pain every time there's penetration. So you need to go to the hospital. It's essential, right? You need to check if you're suffering from vaginal dryness. Are you having issues with your genitals? Are there inflammation in your vulva and your vagina? These are the things that could cause pain. It could also be that you have underlying infections or conditions that could lead to you actually having pains during the process of penetration. Penetration, for whatever reason, should not be painful. Because with appropriate lubrication, the penis should be able to pass through the vagina. So if you're feeling pain like you are, it is not the way it should be. So please go to the hospital and get the needed help that you need. So this person say, I have this boil on my right testicle that has refused to go away since 2021 before I got married. The surface is not open, but it will get ripe and hard. I also don't have good morning erections in the last 2 weeks. I'm 30 and I'm married. So this is 2025. And then you had this boil since 2021. So for the last 4 years, you've had a boil, or what you call a boil, because maybe it's not even a boil. Because if it's a boil, it should have developed and pause and everything and then go away. But you've had this mass, like you've had this swelling in your testicle since 2021, and it's never taught you to go and check it out. That shows that you're not conscious of your health. Now, as a man, you need to realize that the testicles is like one of the most important parts of your body. Now, let's divert away a bit from sex. Your testicle is where the hormone testosterone is produced. Now, testosterone is essentially the major hormones in a man's body. It's the reason you grow muscles as a man. It's the reason you grow beards as a man. Everything that makes you manly is testosterone that produces, and it's produced in the testicle. Now, also, it affects your whole sexual process, erection, ejaculation, formation of sperm, as the case may be. So it's appalling and quite disappointing that since 2021 you're having a boil and you've not gone to check it out. So you should actually check it out. It may not even be a boil, it could be a tumor. And if it's a tumor that is growing on your testicle, it's a problem. It could affect the functioning of your testicle. So what does it result in? Some of the things that you're mentioning here, right? Because your testicle is responsible for producing the testosterone that helps you to have and maintain erection. And now you're saying you no more have morning erection. What if whatever is growing on your testicle has now affected your testicle testosterone production? So this is the result of what you see. So please, it's essential you walk into the hospital. You need to have that growth on your testicle assessed. It may not even be a boil. Have it assessed. It's essential. You're getting married and you're expecting to have, most likely you want to have children. It's not just about being able to ejaculate, as we usually say. It's your testicle that is responsible for the quantity and the quality of your sperm. So if there's a growth there, and let's say it's a tumor and is affecting the function of the testicle, it means the quality and the quantity of your sperm will fall. Meaning that you are less likely to be able to father a child or to get somebody pregnant. So you're already in a very precarious and dicey situation. So it's essential that you go, please get yourself checked out. And that's why we advise testicular self-examination for all men. So just like women do breast self-examination, men should be doing testicular self-examination every month. We call it playing with your balls. So every month you're supposed to look at your balls. In fact, you should do this. It should be something you should be doing like weekly, but you can do once a month. So oftentimes, after you've done bathing, so that you still wait and it could help you to roll the ball, you stand before a mirror. First thing you observe your ball, you look at it. So looking at your ball, what are you looking out for? You're looking for change in color. So let's say your groin region, your penile region is, you're a dark person. So your groin region and your penile region is all dark. And you notice that your testicle is fair or has a fairer complexion than other parts of your groin. You should know that something is wrong there. So you're looking for swelling, like in the context of what he just said. You're looking, is there any swelling, boil, rashes, tumor, whatever it is there any swelling? That's what you're looking out for. You're looking out also, you're touching it to feel for pain. As you're touching, are you feeling any pain? You're not supposed to feel any pain when you're touching your scrotum. Then you try to move the balls around. Are they moving around? Is there swelling? So because sometimes water may collect in the testicle. Are they swelling? These are the kind of things you check for. And this will help you to be able to notice when there are abnormalities so that you can go and get yourself checked out. And this will really, really help you. Then the next question we have is, nurse, please, I want to know why I hardly ejaculate whenever I'm with my husband. No amount of foreplay will make me to come, even though we do up to 30 minutes. Right? So now the first question would be, if you've ever had sex away from your husband, have you ever ejaculated? That is very essential to establish. Have you ever experienced it? That's if you've ever had sex away from your husband. So it's essential to know. Now, like it is said, the process of, female climax and male climax is quite very different. The female one is quite complex than the male one. So it's essential that the right things are touched, the right body organs, let me not call it things, the right body organs are touched, they are touched at the right intensity and at the right time, at the right frequency. So it's not just about touching, it's not just about knowing where to touch, it's knowing how to touch it, for how long to touch it, how deeply should the touch be, or how light should the touch be. So this is something that you need to work together with your spouse, right? Because when you're saying up to 30 minutes, it's not just about the penetration. And it's also essential first to know if you're somebody that has been circumcised. Now, it has been established that people who have been circumcised find it harder to ejaculate than people who are not, especially because most circumcision leads to the cutting away of the clitoris, either partly or fully. And the clitoris is quite very, very essential for female ejaculation. Now, when we look at the development of children before sex differentiation, if we're looking before the differentiation into male or female, we see that what the penis is to the man, that's the same thing that the clitoris is to the woman. So we know the role that the penis play in the context of making a man ejaculate, that is also the role that the clitoris play in the context of making a woman ejaculate. So that needs to be established, that there's an existing clitoris. Yes, we know that other parts of the body can be stimulated, but that is the most likely part that needs to be stimulated. So once we are able to establish that, we also establish if you've ever experienced ejaculation before. Now comes the question, because as a lady, you need to know yourself, right? Because it's important that you know the part. People are sensitive differently, that different sensitive part of the body. Some people are more sensitive in some part than others. So you decide that. And if this happens and it still doesn't happen, you and your spouse need to meet a sex therapist who will guide you people through what is needed to be done. For the next question is, can a HIV positive lady get married to a negative partner without infecting him or their unborn children? Yes, not just a positive lady. Anybody who is positive can marry a partner who doesn't have the virus and will not pass the virus to the partner and the children that comes from that union. So how does this happen? In the course of HIV treatment, there's something that is called U equals U, where from appropriate treatment, the virus has been suppressed to an extent that it is undetectable, which is the first U. And because it is undetectable, it becomes untransmissible, the second U. So when it's not detected, it cannot be transmitted. So if the person that has the virus has undergone treatment and followed the treatment regimen judiciously to the point that they achieve this, they will not be able to pass it to their spouse, even when they have unprotected sex. And also, they will not be able to pass it to their unborn children. In the context of this question, it was a lady. So even while giving birth from the vagina, you will not pass it to the child. So it's essential. That's why it's advisable that people living with HIV and who are undergoing treatment stick so much to their treatment regimen. It's very, very essential that they stick so much to their treatment regimen, because when they achieve this, they would be able to pass it to their spouse who does not have the disease and also their children. But then, even when you attain this level, this U equals U, it's essential that you keep taking your treatment judiciously, because if you falter, the viral load will come up again and then you'll be able to transmit. Another question we have here is, at what month should a pregnant woman go for antenatal? Unfortunately, in the African space, the way people utilize antenatal is arguably poor, if I should say that. Now, this is because everybody have different perspective to it. There are some people that intend to go to church, some intend to go the traditional way, and the rest. But the right thing would be that once you know that you're pregnant, is it at 1 week, 2 weeks, 1 month, 2 months? Once you know that you are pregnant, you should start antenatal. Once you miss your period, what the next advisable thing is for you to do a pregnancy test, because pregnancy is the most likely cause of a missed period. Not the only cause, but the most likely cause. So if you miss your period, get a test done. And once you know you're pregnant, go and register for antenatal. Now, why it's essential to register for antenatal this early is because there are certain instructions, there are certain drugs that, there are certain care that can be given to you. There are certain tests that will be done to know what is going on with you and the kind of care that should be given to you. So let's take, for example, a lady living with HIV gets pregnant. She may not even know that she's living with HIV. She goes for antenatal. If that is discovered earlier, she will be placed on treatment such that before it gets to big 38, that she's most likely to give birth. The viral load has been suppressed and she doesn't pass it to the child. But if such a woman waited and maybe decided to start antenatal at 6 months or 7 months of pregnancy, by then there's no treatment that can be done and there's a likelihood that she can pass the virus to the child. People that come from a family with hypertension, or maybe that for whatever reason they're at risk of having maybe a pregnancy condition like preeclampsia, it's essential that they are checked early and they can be given treatment option. Very, very essential. So this is why you need to. There are also routine drugs that needs to be given. These routine drugs are given so that the baby can develop, the baby and the mother can stay healthy. So this is why it is essential that as soon as you know that you are pregnant, you should resume antenatal. Then we have another question. It's my time of the month. By my time of the month, she means I'm menstruating and I'm having brownish dropping instead of a normal flow. Right. What could be the cause? Now, let me add this because another person asked. I noticed my period usually starts with a brownish color before the normal bleeding. My period comes 2 to 3 days before the usual date. Could this be a result of the drugs I take to reduce the pain? Now, the issue with the brownish color menstruation is the fact that is what we call oxidation. That when blood is exposed to sometimes there's this bleeding, but this blood does not come out as soon as it does. Then it becomes exposed to oxidation occurs. So when this occurs, the blood that comes out is not that bright red again. It becomes brownish. So oftentimes that is what that is. It does not have to do with the drugs that you are taking. Now, the issue with my period coming 2 to 3 days before the usual date is that your period is not clockwork. It doesn't always have to be on time. Yes, you can track your period. You can use different apps to track your period. And they may tell you that your period is going to come at a certain day. But it doesn't essentially mean that it must come to that. It can come few days before, it can come few days after. Now, this is because your period is regulated mostly by hormones. And these your hormones fluctuate. Now, so many things can fluctuate your hormones. Stress, your state of mind can fluctuate your hormones. So let's say the period was in the process of coming on the 30th of this month, but then you become too stressed and the period has to wait to come maybe a week after. So we see this especially like in athletes, female athletes who are preparing for maybe a competition. We know that oftentimes their period even ceases totally because the stress they are putting themselves leads to the production of androgens, mostly testosterones, right? That impede the whole menstrual cycle, impede the whole hormone flow that controls the menstrual cycle. And this becomes a problem. So your period doesn't need to be clockwork. It doesn't always have to be on time. It's essential that you know that so that you do not use that to cause problem for yourself, because most people may even think and get themselves emotionally stressed that it also becomes a time for you to it becomes a time for you to actually get the period and you do not get the period. So if you're just joining us, we've been answering some questions from the anonymous chats that we have on our WhatsApp channel. This is the Intimate Matters podcast, where we take you on a deep dive into the world of sexual and reproductive health. You can follow us on all our social media platforms: Instagram, Facebook, TikTok, and also join our personal WhatsApp channel. And there you can ask questions like this. You can get the anonymous link and ask questions, and we'll be glad to answer these questions like we're doing. And also you could get to meet to chat one-on-one with all of our guests and get your question answered. So for this question, a lady asked that she had a manual vacuum aspiration on the 4th of the month, and then she's seen her period on the 8th of the next month. So when likely is her fertile window and ovulation time? Now, what that means is that for you to already see your period means that you've ovulated, because ovulation comes before menstruation, right? So the best thing that you can do for yourself, for you to be able to know a particular fertile period, is that you need to track your period. Now, since you want to know immediately, it may not be easy to track your period now because you do not have enough data to be able to track your period. It could be advisable that you go buy ovulation kits. You buy ovulation kit and you use this ovulation kit. What an ovulation kit does is that it measures the level of certain hormones in your body. And at a certain point, it tells you when these hormones peak. There are certain hormones that peak in your body when you are about to ovulate. So that is what an ovulation kit will do for you. So it is essential that you do that. Now, this person asks, I'm aware that too much intake of drugs is harmful to the kidneys, but I always experience painful menstruation every month, which I've seek solution to it, and it's not working. And all the solutions are not working until I take an analgesic. Before it will be a little bit okay, or else the whole environment will know. So what do I do? Now, there's no excuse whatsoever for you to routinely take drugs that you should not take. It's essential. Like you said, it can cause damage to your kidney and also damage to your liver. So what I would advise would be that you look for non pharmacological treatment So we're talking about you using hot water bottle. We're looking at you using massages. This could help. It doesn't always have to be every time. There has to be a pharmaceutical treatment that you need to use drugs. No. Like you said, thank God that you already know the danger that it poses to your body system. So it's essential that you seek for other forms of care that doesn't necessarily has to do with drugs. And if you use this, it's going to be essential. It's going to be essential for you. And then for this last question, it said, is it okay for a lady to take folic acid and the B complex vitamins? If yes, how often should it be taken? Folic acid and the B complex vitamins are supplements. A supplement is, like the name implies, supplement is meant to, help with what already exists in your body, to take it to the right amount that it should. As a rule of thumb, I advise that people should not take supplements as an everyday meal. That's what I would want to say. You take supplement. Oftentimes, this is advice to women who are trying to conceive and who are actually pregnant because of the demands or because of preparing their body for what they're about to go through. So for you to keep this and take, I don't advise that it's something that you should be taking every time. So as a lady, yes, if you're trying to conceive, if you're pregnant, these are things that would be recommended for you to take. But for you to be taking it daily, maybe for the whole year, no, you should not do that. You should know that this is a supplement and you should try to space this out. So those are the questions that we've been able to answer coming from the anonymous chats in the WhatsApp channel of the Intimate Matters podcast. And we're sure that you've had a whole lot of fun coming this far. And we know that by now you may have already clicked the subscribe button. If you've not, please do well to do that. Like this video. You can drop a comment and you can ask your questions in the comment and we'll be glad to answer your question. And make sure that you share this video to your friends, your family, your loved ones, everybody that you think really needs to see this video, because this is why we're here. This is why we have the Intimate Matters podcast, a podcast that is dedicated to look into the most intimate aspect of your health, being your sexual and reproductive health. And we believe that if we do this, we can create a healthy reorientation that will make people to stay healthy sexually and as it pertains to their reproductive health. My name is Akwaowo Akpan. I'm always your anchor on this podcast. And I want to say that it's been my pleasure for us interacting with you. And we hope that you'll be here when we come your way next time. For now, goodbye.